Welcome. Thank you all so much for joining us today and spending your Friday morning, couple hours today with us. I'm Julie Keller, the Executive Director of the Women's Fund for the Fox Valley region. So we're thrilled to host our Connections Banner event. We do this event twice a year in the spring and the fall to bring up issues that are important for the mission of the Women's Fund. And today we're doing Victim of Crime Act funding. My husband told me you use too many acronyms, so I said thank you for that feedback. Victim of Crime Act funding today. So love our panel. Thank you guys so much for coming and for being part of this today. We really appreciate you taking the time to be here and basically learn about this important issue. So how it's going to work today is I will have the panelists introduce themselves, talk a little bit about what they do and who they serve, and then we have some questions to hopefully get everybody up to speed on what has been happening in this particular funding source for these agencies and others in the room. And then we'll have some time to kind of talk about what we want to do and what things we as a community can do, what conversations we can have to make an impact. So do you want to start?
Sure.
Just go down the line.
Good morning. My name is Noelle, and I am the Associate Director at Reach Counseling Services.
Hi there, I'm Kristen Schimberger, and I'm the Executive Director at Reach Counseling.
I'm Tracy Plowman, and I am the CEO at Harbor House Domestic Abuse Programs.
Hi, I'm Nick Ross. I use they, them pronouns. I am community outreach and education for Diverse and Resilient. And I will do my best to represent my director, Reiko, who couldn't be here today.
My name is Kristen Kelly, and I am Executive Director and a founder of People of Progression.
Do we just want to go the other way then? And do you each want to talk about a little bit about your organizations and who you serve, Kristen?
Sure. So our organization, People of Progression, serves Outagamie and Winnebago counties mainly. We do serve some of the outside areas depending on the need of the survivor and if there needs to be transportation and things like that, or support. Our three focus areas are support and advocacy services and holistic health services, as well as youth prevention education services. And we serve predominantly targeted services for African Americans and the Black community, but we do serve everyone with support and advocacy services.
So Diverse and Resilient is the largest LGBTQ nonprofit in the state of Wisconsin. We have two offices, one in Milwaukee, one in Appleton. The Milwaukee office opened in the late 90s, really in response to the AIDS epidemic, and really focused on HIV prevention and care. And then over the years, we've added a bunch of different programs, including our anti-violence program, which is the program I work for. We have advocates in Milwaukee and Appleton, and we work statewide. We have a statewide resource line for any LGBTQ person looking for resources and support. We support survivors of all violence, domestic violence, sexual assaults, hate violence, and other forms of violence as well. And there's something really important that I'm forgetting. Oh, so the Appleton office opened in 2019, which is when I was hired. This was a passion. The Appleton office was opened to host the AVP program, which was a passion project of my former director, Kathy Flores, who many of you may know who that is. And so we are just trying our best to continue on the legacy that we worked hard to build.
So Harbor House is a domestic and sexual violence program. We do limited sexual violence. So we have numerous programs within Harbor House. So we do have a 68-bed shelter. And from the time I've been there, it went from a 35 to a 44 to a 55 and now a 68. And so we do have that program, but within that, we also have a legal advocacy program that helps people navigate through the legal system, which is very scary and daunting. We have a children's program that works with kids that are in shelter and also kids that are dealing with domestic violence who don't actually need safe shelter, but they still need help. We have adult advocacy. We have a housing navigator that helps people with trying to find affordable housing when they're ready to leave the situation if that's their choice. We have a 24-hour crisis line where we are open and we have advocates 24 hours a day. I know I'm forgetting some things. We have an amazing volunteer program. We have about 100 volunteers that volunteer for us every year. So there's, and then we, within the past couple of years, kind of, I don't know, but we branched out into doing some sexual violence. And so what we're doing now with it is that we are focusing mainly on helping REACH with SANE accompaniment, so sexual assault nurse exams, and then just short-term advocacy. And we also have an offenders program. So we are the one domestic violence program in the state of Wisconsin that actually provides not just the assessments for courts and probation and those sorts of things, but we also offer services to that family member. Because what we found is that the vast majority of people who offend were probably child victims. Actually, we have stats that prove that. So we do the assessments. So when somebody's arrested for domestic violence or they're on probation for it or whatever, we do the assessments actually for 5 counties because there aren't that many places that do it anymore. But then 2 years ago, we actually started offering services. So there are coordinators or advocates that work with the offender. We do small support groups. So anywhere from 8 to 10, we've had to take a few more, but it's a more, I would say, intimate but safe setting for offenders to actually open up and talk. We've actually had some of the groups ask us to continue to use our space so that they can continue to meet. And we focus mainly on parenting and coping methods. So.
All right, well, Reach Counseling can be our sexual assault service provider. We have 2 office locations, so one in Neenah and one in Appleton. We serve Winnebago, Calumet, and Outagamie counties. And as Tracy mentioned, as of this month, we are partnering with Courthouse. So in the aftermath of sexual violence, if somebody presents in one of the local emergency rooms, either a staff member or volunteer from Harbor House or Reach will go to the emergency room to be there to support the survivor throughout that entire process. So we provide personal, legal, and medical advocacy. We also are providing prevention education throughout the 3 counties. Also starting to look at a partnership there where Harbor House and Reach can go into the schools together to help prevent domestic and sexual violence. Also provide resources for kids that oftentimes we get a lot of disclosures when we're in the classrooms. And so being there as a partner and being prepared to help with those disclosures as they're taking place. We do provide trauma counseling, so we are a licensed clinic at both of our locations. We also provide sex offender treatment, and so a lot of the sex offender treatment that we provide are through contracts with the state. So as people are coming out of incarceration as part of their parole, they'll come work with Reach, and really like what Tracy alluded to, many of the offenders that we're working with experienced a lot of childhood trauma in their lifetime, and so a lot of that work is really focused on helping them to heal from that trauma and then helping them to be able to cope so that we can help keep the community safe. We are really proud in that nationally, if you look at a reoffense rate for sexual offenders, that's typically around 33 to 35%. We have been tracking historically all of the offenders that we work with, and our recidivism rate is only 6%. And so it's a really successful program, something that we're really proud of. I'll turn it over to Noel. I'm not sure if there's anything. We have a lot of support groups that we offer, and there's a large breadth of services that we provide. So I'm not sure if I missed anything.
No, I think you covered it really well. But yeah, we really, our goal is to have that wraparound response to sexual violence in the community. So both helping survivors, preventing future abuses, and as well as helping offenders prevent recidivism.
Thank you all. So wonderful services, obviously, that's being offered to our community. So to level set for all of us, I'm going to have Noel talk about what is VOCA funding? What is this? And how did it come to be? Why are some of the programs, a lot of programs in our communities are reliant on VOCA funding? And then what is the current state? So Noel is on the board of Wisconsin Coalition Against Sexual Assault. And so she has a lot of information about VOCA funding and what it is and our current state, so where we are today. So
Yeah, another acronym.
yes, right. Another acronym.
So VOCA funding through the Victims of Crime Act has been sustaining agencies across the nation that serve all kinds of victims of crime. So it's domestic violence, sexual assault, child advocacy centers, really you name it. And so to take a step backwards, what goes into VOCA funding is funds from the Crime Victims Fund, or the CVF. And so that was established in '84, and that was financed through fines and penalties paid by offenders convicted of federal crimes, not taxpayer dollars. For decades, this fund has provided vital resources for victim services. However, prosecution agreements which don't result in criminal penalties reduce contributions to the CVF. So more dollars were going out than were going in each year. And so because of that, they've been reducing how much funds can come out of the CVF each year in hopes that they're not depleting it at the same rate as they have been. This has been going on for a bit. So in 2021, Congress passed an act, the VOCA Fix, to sustain the Crime Victims Fund Act, in hopes to help replenish that fund. And this was by redirecting penalties from deferred prosecution agreements to the CVF. They also opened it up to private donations and things like that in hopes of replenishing it through other means. However, the fund is not recovering as fast as they had hoped it would. And so because of that, organizations across the country and across our state are feeling that effect. And I'm sure everyone can talk about their organization, but for REACH, that resulted in a 62% cut in funding, leading to a shortfall of just over $420,000.
For context too, last year, we received $670,000 in VOCA funding, and the max that we could apply for the next cycle was $250,000. And so obviously, and I know we're going to talk a little bit more about this, but it's had a really significant impact on our staffing and just the capacity of the organization to provide the level of services that we've been providing historically.
You want to go, Tracy?
Sure. So for the past 5 years, Harbor House has received $382,000 a year from VOCA, which was significant. We now, for the next 3 years, get nothing. And one of the things that when I looked at, and again, we could only apply for $250. That was the most anybody could apply for. And when I looked at least for me, with the having to run a shelter as being a part of our services, the shelter programs across the state were slashed. So every shelter program had a significant reduction in what they were getting. Not as much as ours, but and so that is exactly what we are in the red, is what we were getting from VOCA. And, I went in and tried to really kind of take a look at our stats, and I was going to combine ours with Christine Ann so we could kind of take a look at really who we shelter a year. And I was going to kind of compare it to like Pillars, right? Because that's a significant, like our homeless program. And what I found is I didn't have to combine us and Christine Ann, because we sheltered 37 people less than Pillars did last year. So we sheltered 533 and they sheltered like 500 and So, so if you looked at that community-wide, if we had to reduce our programming, which is staff and different programs that we have, it would make a significant impact on our community. Because, and then the people we shelter, there's an added lethality possibility to that. And at least for me, it's very important. I'm trying to become a good community partner. And so there are community partners that rely on us and our shelter program. So I have some very serious decisions to make, and I've already made some, and that's cutting back on staff. That there's just certain programs that I don't want to lose. The offenders program, we fully fund the offenders program, but I also believe it's the one way that moving forward, we're actually going to be able to reduce acts of domestic violence, is actually working with 50% of the problem that causes 100% of the issue. And stopping the cycle for the next generation. But that's what I'm looking at right now. So.
What I would add to this is just, first off, like, our program is statewide and we are already seeing partner programs like have to totally stop operations. So for example, in Milwaukee, there's a really amazing program called CRAE, or Collaborative Rapid Advocacy for Youth, that basically does, street outreach and advocacy services for youth in crisis, homeless youth, youth who are being trafficked, etc. And, they recently announced that because of VOCA cuts, they have to stop operating as of the end of the month. And, this is a smaller program that had a huge impact and was also obviously hugely impacted by the reduction of VOCA. And the other thing I would add is, just like Tracy was saying about community partnership, the reality is no VOCA funded program can meet the needs of the survivors it works with 100%. Like, our work to best serve survivors relies on strong community partnerships. And with VOCA cuts, like funding cuts like this, when our partners aren't fully funded, our survivors are affected by that. We are affected by that. And the other thing to keep in mind is that this scarcity mindset does affect relationships between programs. And so all of these things are harmful to the people we're trying to help.
Nick really touched on a lot of the things I was going to say. One thing that I'll add is that really thinking about statewide smaller programs that you touched on a little bit with CRAE, there's a ton of small, either culturally focused or very niche focused, that we need those support systems across the state, that especially as a smaller organization that's now newly funded by VOCA, we're very much in connection with those other niche organizations. And a lot of times we're each other's support system. So when they're not healthy and they don't get what they need, then we're also unable to meet the needs of survivors fully, and scrambling to find out who does have the support, using more of our capacity to find out who is able to, across the state, help a survivor, and then they answer the phone and they're not able to help. And what capacity looks like when you're scrambling to try to find the support for a victim that really needs it.
Thank you. I think I love that community. It really affects the community and the ecosystem of what we are all living in and what you are directly working in. So what are some of I know for shelters in particular, a lot of shelters have expanded from Green Bay to Appleton to Oshkosh. Kind of what does that do for that need, specifically in the shelter area, given the recent expansions in programs in shelter programs in Northeast Wisconsin?
Yeah, well, both Christine Ann and Golden House expanded. they didn't expand necessarily their shelter program, but they expanded into transitional housing, which is wonderful because people who aren't really ready, because we do have a housing shortage and rent since COVID is like 3 times higher than it used to be. So affordable housing doesn't exist right now. And so when you have victims who leave with nothing and we can help them get to the point where they're actually ready to move on, they can't move on because they don't have anywhere to go. And so with Christine Ann and with Golden House, now they both have a significant transitional housing, but they both had capital campaigns in the past like year and a half. And so they've expanded and now they both seriously got slashed. I mean, I don't think each of them got 90,000, I think, $89,000. That's what both of those shelters got. And they're like doubled in size. And we did that 5 years ago, right? I mean, we're the, I think, second largest shelter program in the state of Wisconsin. And so we're all, you know, I mean, we all serve a lot of people, but it is significant. And honestly, just to be transparent, I'm planning to do the same thing. We have 6 apartments behind us. And right now, Pillars is leasing them. And my plan is to take it over once the contract is up, because it's better for our clients. I want to be able to open the doors so the kids can continue to access advocates, and kids that are in transitional housing can continue to access our support groups, and adults can take part in everything that we have because the doors are open. And I don't know how I'm going to do it. And I don't know how, honestly, I don't know how they're going to do it without the VOCA money.
You know, we talk a lot about the direct service, but what about some of the prevention efforts? And you know, we want to put ourselves out of business, right? So what about some of those efforts? And Kristen, I don't know if you can speak or give to some of those efforts about what are we doing to kind of address the problem on the front end of prevention, and how is that impacted by not having some of this funding?
Yeah, so we strategic planned for VOCA funding for 3 years before we were able to apply. And we did have one of the largest pieces of what that funding would have looked like if it was the same as, because we had thought, we didn't know the historical context of how this VOCA funding looked for the past however many years. We knew what it was funded the last 2 cycles. So we planned on about that amount and what we would do with possibly $1 million grant funding. And the huge piece of what we were planning on was prevention education, because the amount of Black and African American people here who are not getting that culturally targeted support that those kids need, that it looks very different than what mainstream prevention education efforts look like. And we need more of those targeted services. And when they don't happen, we have kids that grow up that weren't targeted with those services. And when we have individuals fleeing violence from across the state, more urban areas, because this is we're in the, I'm going to use some other, let me not acronym it out. So we formed a culturally specific interstate collective for multiple issues across the state, because Wisconsin is nationally recognized as the worst state for Black people to reside. And it is for many reasons, which I could not take up this entire panel of speaking on. And so we created that collective also to start to organize behind understanding people coming from Chicago, Milwaukee, Fond du Lac, Oshkosh, Fox Valley, up to Green Bay, when they're fleeing violence, and what happens when somebody from an urban area, who the shelters are very different there. They're educated in different ways. They know, it's just when somebody leaves Milwaukee because they can be easily found by somebody who's trying to harm them, and they come north, they think that services are going to be understood the same here as it would in an urban area. So if it isn't, and then they're either not understood here and then exited out of a program early, or there's just a two-way misunderstanding. The survivor doesn't really understand the different policies here, or doesn't understand that services may look different, that also the other way, that the person giving them services may not understand them, or there's language barriers, although Black and African Americans here, unless they're of a different nationality, they don't have their own language. So they're forced to speak English in a sometimes not the best way if they haven't been educated in ways to be safe when they're here. And I know that sometimes I can not make a lot of sense, but if there's a cultural barrier, even when you're speaking the same language, that can harm you. And we need to prevent children from, when they're here and possibly in homelessness, and because of their family fleeing violence, and they'll not get the support with targeted prevention services to make sure that they grow up to have a healthy, flourishing life and understand what healthy relationships and boundaries look like for them if they're not also seeing that same support within different programs that they're navigating with their parent. We've seen it time and time again where kids who are especially in graduating years, it's very difficult to help a child understand when now they're being handcuffed or they're being discriminated against, or they lash out, that they might be at increased risk here in many different sectors, including just trying to find safety, whether that's legal or also in the domestic violence or prevention community.
So the VOCA funding that we receive is mostly for direct service. We do prevention activities through our groups. So like we have a youth group and we have an adult group. We talk about healthy relationships and boundaries and red flags, green flags, that sort of thing. But I'm basically trying to pass it because our VOCA funding focuses on the direct service side, and we do our prevention through other means. My position is funded through other sources, so.
I was also just trying to get to like, will you have to move your unrestricted funding to your drug services because of a shortfall in VOCA funding? And so then those prevention type services might not be as funded or be available if you're moving some of your unrestricted funding to more direct services versus prevention.
Yes.
Yeah.
I mean, for us, like I said, especially now, we're not getting any. And so, we've always had a strong prevention program. And it will all be funded by our general operations because there isn't any state money or VOCA money coming in. So, and right now we do both, but I'm actually hoping that our partnership will help both of our programs kind of handle the balance and also get the youth impacted and at least some education on both those issues early, because we know early prevention is the best prevention. It for us, 100% has to be, I have to find the funding somewhere else.
We started strategic planning specifically around prevention education when we got the VOCA funding cuts. So we've done some things a little bit differently just to increase our capacity this year. So we applied for a grant, and we do have an open position for an AmeriCorps position, which we're hoping to bring on into prevention education in the classrooms with us this year. We also have a few interns from UWO, UWGB, and so we've tried to build up the team with interns and also some volunteers, which is a little bit newer for us. So we have a healthy sized team at this point in time. However, knowing as we're starting to look at staffing cuts and things, that is one of the programs that is drastically underfunded. And so having to look at where we would have to remove positions, unfortunately, that would probably be one of the first programs that we would have to look at. Serving the 3 counties, there's a huge demand for our services. You know, we put the schedule out in early September and we are already booked almost through spring break, like at full capacity at this point in time. And so we've never had to have any kind of like waiting list or have to turn anybody away in the past. However, I know our team this year has had to have a lot of conversations like, please sign up right away. We're not sure, you know, we can't guarantee that we're going to have spots for everybody. And we've never had to put any kind of messaging out like that in the past. You know, we would hate to see some sort of like waiting list or, you know, having to turn people away for our services, but absolutely, I would say prevention ed, you know, with us not having the funding there and having to pull from general operations, that would be one of the first programs that we would have to look at scaling back.
Absolutely. And something that I've heard a lot in conversations across community partners, we're talking regionally or statewide, is that prevention is unfortunately one of those first things that gets cut because a survivor in the immediate aftermath absolutely needs services. Not that prevention isn't also critical in the long-term strategy, but when you're in fight or flight day to day, have to make it to the next day, have to keep the doors open, the thing that's prioritized most is that immediate aftermath response to sexual violence. But we know we'll never work ourselves out of a job without prevention education and a strong prevention education program. Another thing I will say is that prevention funding is hard to find. There is a lot of restrictions on prevention funding. And so our prevention educators are dual. So they do youth and teen advocacy as well as prevention education. So they're partially funded by VOCA, partially funded by our one state grant that gives us a little bit of prevention dollars. And so knowing that part of their salary is being slashed through the VOCA funding, it's just another added struggle for our organization to make sure that we can fund that program because it doesn't collect any revenue, of course. So it's solely donations and grants that keep that program going.
What about what trends have each of your organizations seen and the people you have served, maybe since COVID or in the past couple of years? Are there any notable trends you're seeing in the needs of people and how that has changed your services or how you've had to adapt? Anybody want to start out? Go ahead.
I don't know. We can move back this way. So definitely, I think we were talking about this earlier. The pandemic was a huge hit on all crime victim serving organizations, especially after Safe at Home was lifted. We had, you know, survivors living with abusers. We had children, you know, dealing with sexual violence at home and not being able to have a safe adult to go to at school to disclose abuse. So there was a drastic increase in disclosures and folks coming for therapy. I know shelters were immediately just feeling that hit. I mean, even partially during Safer at Home, I was at Christine Ann during that time, but especially post Safer at Home. And seeing a lot of more complex trauma as well. So when folks are coming into therapy, obviously they've always been coming in with that sexual violence lens, but on top of that, it's the isolation of the pandemic, it's food insecurity, it's housing insecurity. And so they're staying with us for longer and they're having to take longer to get to a good place on that healing journey. And then the other trend that is really on my mind and on our advocacy team's mind and now Harbor House's mind with our partnership is SANE exams we've been hitting record highs for the past 3 years for the amount of SANE exams we've responded to in Theta Care and Appleton and Aurora and Oshkosh. It used to be once in a blue moon, maybe twice a year, we'd have 2 a night. And now we're having advocates have 2, 3 a night calls to go to the SANE room. So there's been a really drastic increase. I couldn't tell you if it's the instances of abuse or that people know about the resource and they're using it more, but we are seeing a really significant increase year after year in those exams.
And that definitely is something, that volunteer response, that really puts a strain on the organization because we're trying to provide a work environment where people can have a work-life balance. And when you're on call 24 hours a day, 7 days a week, and you're having to respond to 2 or 3 instances in the ER in the same night, you're that person on call. it's a huge strain, and it's also a really difficult program to recruit volunteers to. It's really in-depth training that's required. It's a really scary thing to show up and meet somebody who has just been recently victimized in an ER. And so as much as we are out there trying to recruit volunteers and we're working with Harbor House to build up that volunteer program, it's a really difficult position. And you're asking people to be on call in the middle of the night and on the weekends and on holidays. And so I know Ascension recently reached out to us this past week, and they're looking at adding a forensic department, which, yes, great for the community, but to think about having to respond to another emergency room when we're already really struggling at this time to respond to the two that we are, it's a scary thing. I know my staff saw it and originally they're like, wow, this is amazing. And then kind of the reality set in of like, oh my goodness, how will we be able to do this? And so, yeah, that is something that is a continual, I think, struggle for us to be able to do.
Kristen, what about you on the end? You have something?
Yeah, so some different things. I have a couple negative trends and then maybe a positive. That the number, I think I touched a little bit on survivors navigating across the state. So we've definitely seen an increased number of people returning to unsafe situations, whether they are leaving either a shelter in the area or whether it's domestic violence or in a homeless shelter or transitional housing. And if they either were there for their, they knew when their exit date was, or if they didn't know when their exit date was, they don't have the support needed when they do exit. I know Tracy touched on like housing going up, with not having the resources to help them make sure that they have housing. Well, if they left an urban area, that it's easier to find housing because there's more and more slumlords there that will open the doors to them, that they'll go back or be forced to go back to an unsafe area where then they're at greater risk of homicide. And going back also to the person who victimized them. And although we've seen those increased numbers, and actually, let me backtrack back to the renters a little bit. So although this isn't specifically domestic violence related, we've seen an increased uptick in, and this is just like qualitative, like when we hear feedback from, and we're trying to navigate with the survivor through their situation, the amount of slumlords in our area and more in urban areas that will use a situation where maybe the police were called because of a violent situation at the home, and then they evict them because they had police contact. That especially happens here. Like one police contact Black person, you're out of the housing, because so much housing discrimination and non-understanding of just humanity and people and trauma and how that affects somebody or a living situation, that if they are evicted, we're seeing an increased amount of unfair, not just the eviction, but tacking on things onto the eviction. Unjustly saying that the whole apartment was trashed. We had to rip out and gut the entire apartment. That's a $10,000 bill that they're putting on. We've seen it. We're just dealing with it last 2 people in the past 2 weeks that have huge eviction bills, and these landlords are winning in court every single time, let alone that survivor even actually being able to make it to court, because now they're in a totally different city, still fleeing violence, and can't make it to their court date. The only one, because you don't get an appeal. So by the time they even find an advocate to say, holy crap, that's not right, you can't even appeal it. And then how do they get housing after that? Because landlords here in this area aren't picking you up. And then what do? Send them back to Milwaukee? Send them back to Chicago? Because that's the overall community here that we hear a lot, go back. So those types of things are very much trending, and we deal with that weekly. And then the more positive is that the more that we build awareness as a culturally specific organization and working together as a collective statewide, the more we build awareness within other programs, prevention or intervention or shelters or whatever other organizations that we're trying to work with that are more mainstream, the more that we build awareness, the more that we can co-advocate in those spaces with their advocates and with their employees to build the awareness. Because if you're not somebody that's always hearing that and seeing that and also coming from the same cultural background and barriers, you don't even understand that it's a thing. And then you're just looking at a Black woman or a Black person thinking that they have an attitude and or their mental health is too complex to serve them.
I just wanted to add, like, I don't think it can be underscored enough, like the impact of the housing shortage on the work of our programs. Like, many survivors are experiencing homelessness as a result of complex trauma, including domestic violence, sexual violence, etc. And so, of course, our programs would be a great resource for them, but our programs are not intended to, for the most part, are not intended to provide that long-term housing support. And yet, we still have to meet the needs of our clients, so we end up doing that anyway, right? So like the housing issue, especially when you remember what Kristen said about housing discrimination for Black folks, other people of color, and also trans people, members of the LGBTQ community. Our trends are that, like, across our two offices, we mainly work with LGBTQ folks of color because of, the increased need and lack of support that those individuals can get elsewhere. And with that, sorry, let me collect my thought for a second. Oh, and so, another thing is that in order for like a program like ours to provide things like housing assistance, our funders, including VOCA, require very specific forms of documentation that are often unobtainable for the people we're working with. So many people are living, with friends or with family members, don't have access, like they're not on the lease, yet they still need housing, or they can't access, a form. They can't go to their landlord and say, fill out this form so I can get rental assistance, because the relationship isn't there, because it would put them at risk, et cetera, et cetera. So all of that, like we need more infrastructure and support around homelessness, so that our programs can focus more on that, responding to the violence. The other thing I would say specifically for our program is, VOCA is expansive in its definition of violence. And so, we are seeing definitely like a rise in hate violence. We are providing legal advocacy to folks experiencing hate violence. I truly believe that this rise is a result of, the climate we are in, the dehumanizing way that politicians talk about LGBTQ folks and trans folks. We are dealing with homicides related to hate violence. We have number of Black trans women in Milwaukee who have been murdered. Many of their cases are still unsolved, do not even have suspects attached to them. And, this is serious. And I think it's about the way we as a culture are talking about our LGBTQ community at this moment.
Christy, do you want to answer whatever you want to add to that conversation, and also maybe tie in the DV homicide stats in Wisconsin?
Sure. So I think, as far as trends, there's a few issues. One is the things are so much, people are coming in so much more complex traumas. And so, you know, for us to focus on domestic violence, we have to put in a lot of time and energy and things to get actually to the domestic violence, because there's so many other layers. And what Kristen talked about, we're dealing with that right now. And Greta is our consultant and knows, I mean, literally at this moment, we're dealing with even staff that, because they don't communicate in the same way, we have issues, right? And it's the same thing with our staff and clients. When somebody communicates a certain way, because that's who they are, right? And so we're working on it, but it's tough, especially, and it's just unique. Shelter programs are unique, right? If you have never worked in one, you don't get it. You just don't. And it is very difficult because you have so many different people who are coming in with complex traumas. You have parents who are traumatized, who are trying to parent traumatized children. You have everybody in fight or freeze mode. You have them responding based on their coping skills, which look very different, right? And then staff trying to figure out why this person acts this way and this person acts this way. And it's tough. The hardest thing that we do is shelter by far. And it is very difficult, especially when you have the 68 bed shelter and it's full and everybody's full of trauma, and we have to try to navigate it. And so it is difficult. We are full. And the layers of trauma that come in our door are very, very difficult. And then they have to try to cohabitate together, which doesn't also work very well. You know, so there are just absolutely so many layers, and then people come in with nothing. And we have to figure out how to help them get what they need. You know, for me, it's really just going back to grassroots. Let's first start with basic needs, and then we can try to build from there. You know, unfortunately, right now, the biggest trend is that Wisconsin is now the eighth highest in the nation for domestic homicides. So people are dying, which, you know, that's kind of what I meant with, and I hate just focusing on shelter, but it's the most expensive thing that we do. And when we serve as many people as our homeless program, at least in their family shelter, that's a lot. But then add layers of lethality to that, add threats of death or threats of violence to the people that come in our door. And so it's hard, you know, for me, I've been doing this for 20 years. The hardest thing that I've had to do is ask somebody to leave. But again, when you have 60 people and one person's coping method is threatening people, it's difficult. But again, a big part of it is that communication issue and not understanding the complex traumas that people bring in our door. So we're learning. But that lethality, how is Wisconsin the 8th highest in the country for domestic violence? And a lot of nationwide, a lot of the violence has gone down. Domestic violence has gone up. So, you know, last night we had an event and Mindy, our district attorney, spoke, and we are there every day. We are at the courthouse. We are doing restraining orders. We are doing court accompaniments every single day because of domestic arrests. So.
So that's a down note, but let's talk about what can we do as individuals, as a collective community?
Can I add one more
What's
thing?
possible? Yep, go ahead.
Because I thought that this was important. So with the area that we're a great area. Fox Valley community has been like shown across the state that we are a safe area. Whether that's safe for everyone or not. So people are traveling here because that they think that there's opportunity. And if they are leaving the area after maybe they didn't get that opportunity or because they're fleeing violence, there's all this different complexity between how you can become stable. I think that there's a very large gap in even what those numbers truly are in our statewide data of homicides related to domestic violence. Because of the amount we've dealt with just in the past 2 years, we've dealt with several cases of people going back to a more urban area in Wisconsin because they were fleeing there to come here and then going back to the urban area. And because of the way that policing sometimes happens, that they're unable to report it or the investigation isn't actually getting down to the fact that it was domestic violence, especially when you're talking about Black people. So I think that the data also that you're seeing is very skewed and that vulnerable populations, let's say it's Black or queer or Latinx or Indigenous, that these more vulnerable communities who don't feel safe just existing in our state are not reporting, and it's not ending up in those stats. Because we've had several cases of murder, suicide related to domestic violence, and we know that it was not reported.
I just want to thank you for bringing that up, and absolutely that I think the data would not show the true picture of, LGBTQ survivors of violence all the way from, instances of LGBTQ intimate partner violence are not reported as such by police who respond. So incidents all the way up to homicides, because of the complexity as well of family members who may not accept the loved one or their identity who passed away. All of these things also mean that we're not truly understanding the impacts of domestic violence on the LGBTQ plus community as well.
Very true. I actually went in at one point and tried to figure it out because I was looking at the domestic violence homicide reports. And I knew just based on our community and a few other communities that I had contacts with, that the police were not reporting domestic homicides as domestic homicides. And that was, I did that probably 8 years ago. And it's a lot worse now.
Yeah.
Anytime you see roommate,
Yep.
You want to question that.
Yep.
Yeah, and also just putting into context, if depending on the lens that the person wears behind the badge who goes into a situation, if both Black people are getting arrested in a lot of circumstances because they're just saying, oh, y'all both just need to go to jail because you're getting too rowdy and this is just what I know of these kind of people, and they come in with that type of bias, then we're not seeing that there's a victim and there's domestic violence happening. So, and that's outside of a homicide. So if that's just happening every day, then what happens when someone gets killed?
Very good points. Yeah, we know that data is very underrepresented and underreported. And so we can talk about the data and look at trends, but we know that there's so much more. So thank you for specifically bringing that up. I appreciate that. Before we go to the next thing, I wanted to just talk, This is just a sample of how VOCA is in our community. I know that there are others here. If you get VOCA funding, can you kind of call yourself out on it? And do you want to just introduce yourself quickly and your organization?
My name is Bernie Lutsky. I'm the Executive Director of City's Victim Crisis Response Team. We serve Winnebago County, Allegheny County, and a little bit of Calumet. We have 2 staff, myself, and then a volunteer coordinator. We have 60 volunteers. We work with 16 different law enforcement agencies. We're called out to all types of trauma and victimization, whether it be infant death, domestic violence, suicide, homicide, traffic accident, sudden death, anywhere where they feel that the victims can more support. We provide victims with all types of different resources. Every volunteer has an accordion file of different resources that they either go over the victim if possible on scene, or they leave the resources, and then we also do a follow-up call after. We do a lot of referrals to everyone on the panel. Yeah.
And you are all, you're VOCA?
We were solely VOCA funded. When I started, I knew that this was like coming down the line. I did a lot of work to do, like, kind of build like a bit of a safety net, because I was like, ooh, what's the bank account when I started? I was like, this is one cut away from being done. I mean, it was strictly run on VOCA funding. We did a bit of reshuffling. We used to have 3 part-time. We moved to 2 full-time staff, and then we get a lot more done. We actually expanded into Oshkosh this last year, which is servicing like, another 58,000 people. And we were looking actually prior to the cuts into expanding it further into Calumet. Calumet is very interested in adding us. With the cuts, we don't really know if that's a possibility or not. But yeah. For a lot of, like I said, a lot of the volunteers are incredible. We respond 24/7, so we have volunteers signing up overnight. They do amazing things. It blows my mind that we have to do that, and we're very fortunate to have a team of 60. We've expanded. I think when I started, we had around 28, and now we're up to 50.
Sure. And I'm Lois Bristol. I'm President and CEO at Family Services, and we're the Sexual Assault Center response group for Brown, Oconto, Door, and Marinette counties, and the Child Advocacy Center in Green Bay as well, which serves all of our. So same as many people are VOCA, and we are just one of many organizations in Brown and other counties that have obviously seen impact, which is the story here that's so important, I think, is that it's not just our communities, it's statewide. So the trickle and impact of all of it is just really, but we lost about $600,000 of VOCA funding, just us. So I think in our community it was $1.2 million of VOCA year of VOCA cuts. Not to have that impact victim services and victim serving. It's difficult.
Would you mind just, sorry, because I'm not really familiar with this funding, I'm just learning about it today. Would you go back and kind of repeat why there's so much less funding? I don't think I fully understood when you first went over it.
Yeah, absolutely. So VOCA funding comes from the Crime Victims Fund, or the CVF. That was established in the 80s, and that was financed through fines and penalties paid by offenders convicted of federal crimes. However, because of the way convictions have been going lately, there's been a lot of deferred prosecution, so funds were going out quicker than they were going in. In 2021, they tried to fix it. They added in penalties from deferred prosecution agreements, as well as donations, and really just opened it up. Like, I didn't want to put money in here.
Yeah.
And it still has not replenished in a way that they had hoped.
Thanks, I appreciate that.
I think it was impacted by COVID too, with kind of the shutdown of some of the
Yeah.
prosecutions happening, and
Everything being at standstill for.
Right, stand still for a long
Plus
time, so no money was being put into the fund, nobody was, cases weren't happening. Jolene?
Can I ask a follow-up to the funding? And I want to say, first of all, I was so grateful to work with Julie. I represent the Fond du Lac Area Women's Fund and the Fox Valley Women's Fund, along with the Milwaukee Area Women's Fund. Together, we collectively wrote a letter to our state representatives, and we were down at the hearing that I think you were at as well. And so, so grateful that we have a small win. But what was hard to understand with the information is, so it sounds like that was from the state as a stopgap. The funding that,
Oh, the WIS Act 241 funding?
yeah,
Yes, yeah, so that was, it was really cool to see everyone from the state kind of come together for that. The unfortunate part is that, so yes, several SADV agencies received a boost in funding. It expires in June of next year, so it's very short term, just because of the budgeting cycle.
what does the future look like? And the cuts that you are experiencing, is this potentially a new normal? Is there hope? I mean, obviously as individuals, that was your next question, how can we step up? But from the understanding of VOCA,
Yeah.
is there more information you have about the future?
Yeah, so it's a little bit of both. It is basically right now our new normal for VOCA funding specifically. However, with the new budgeting cycle opening up at the state level, we know that the Wisconsin Department of Justice has requested 66 million over 2 years to help with this gap in funding. And so being on the board of VOCA, I get to hear, and we all hear on our listservs too, of that there's going to be a lot of advocacy coming up at the state level to talk to your legislatures to get more funding in for sexual assault, domestic violence, crime victim services. Definitely more to come on that. I know we spoke to regional funders as well. I'm happy to be that middle person to pass it off to the community as well, because they'll send specific action alerts like, hey, here's a really good script to say to your folks that represent you. And here's when the next big push is happening, and keeping us updated. And so I think it's really important for the community to know those things too, so that we can expand our collective voice. I know Tracy, you had talked to some folks at VOCA as well.
Yeah, we had them come down to Harbor House, and so we were told that this moving forward, this is it. That's what we were told. So as far as VOCA. Unfortunately, what we got, or at least for the most part, that's what we should be expecting moving forward. But then they also said that there will be additional grants that you can apply for, like for us, because we got nothing. They said that there should be a grant in 2025, 2026, and 2027 that all of us, that it's not connected to VOCA, but all of us will be able to apply for to try to offset some of that issue. We don't know what those are yet, or what it really means. I know Mindy, our DA, sits on the committee at the state too, and she told me the same thing. It's like they're trying to find money so that we can all, apply for those grants to try to offset some of the loss. But as far as VOCA, this is what we're supposed to expect moving forward.
Tracy, I don't know if you would say this is true, but VOCA goes on a 5-year cycle. People in these programs are familiar with the process of applying for VOCA. So, even though these new opportunities may be coming, that still is an additional strain on capacity and resources. Not every program has a grant writer full time and all of that kind of stuff. So
100%. Actually, I believe it or not, I was just sitting down with our grant writer, I think on Tuesday, and talked about after we got done with our 40th anniversary event to actually we've been meeting our board programs a few times since spring to try to figure out how we can do things better collectively and have better wraparound services for the people that we serve in our community. And so I was talking to Beck about the fact that not everybody has grant writers, but we have a grant writer. And so, and Reach does. And to to try to get people together from the smaller programs so that the people who do have grant writers can help with the grants, because we're all applying for basically the same thing, and it would just help all of us. Like all of that kind of stuff just continues. We do always talk about all of the programs, not just ours. And so, but that has been a strain historically, especially for our smaller programs, because they don't have the people that can actually sit down and do them. But for the community and for victims, we all have to figure out how to help each other. And so, yeah, you are absolutely right.
Thank you. I just actually wrote that down as well as grant writing collaborative.
Yeah.
State and federal grants are a whole different animal. And they are a lot of time and energy and paperwork. So yeah, the more support we could get for everybody to be able to have a fair shot at doing some of those, I think would be great. Anything from a individual, collective, community? I know we touched on the grant writing, we touched on advocacy. Anything that anybody would like to bring up as how do we, as a community or as Northeast Wisconsin, because it goes up through, it affects our whole state, but how do we in all of our different areas that we represent geographically and services, any ideas of what you would ask of individuals or community members?
Yes, sir. So one, I always preface with, if you feel passionately about helping vulnerable and historically marginalized communities, and you feel very intently passionate about it, just reach out to us and say, I'm here and I want to support. And we will definitely sit down and talk about what are you passionate about? What skills do you have? Or who are you connected to that maybe you're able to make a connection? Because outside of even domestic violence, if there's biases and fears and things like that, we don't get connected with people unless I'm banging on the door. I know some of you in the room know me. So unless I'm banging on the door, if I'm trying to figure out who that person is, and if I can make the connection, which I only have so much capacity there, we don't have people currently who are on specific board connection or connection at different levels in the state. We just have a couple, but they might not be your people and the people that you're connected to. So just don't assume and just reach out. Also spreading awareness of the disparity and the vulnerability of historically marginalized populations in our area. Even if you don't think that you know very much, you can say that I don't know very much to someone else who definitely might not know very much, and say, maybe we should talk more about this, because if I don't know and you don't know, we need to know. So don't be afraid to look stupid, because I sure don't, and I just keep on going. And also connecting survivors or people in the community. I feel like just a lot of vulnerable and marginalized people are also survivors, even if they didn't realize they've been through a victimization. A lot of times it takes just referring them to a support group or referring them to an event that represents their cultural background or where they fit in the community. And that's where we find survivors and realize and help them come to realization that, oh, no, you actually aren't just meant to be hurt. Like you grew up thinking that this is just how life is normal. It's not. And we would love to talk more about that and get you the resources that you need. So just connecting people to us and making sure that people are aware, because there's far less Black and brown people that you would think that know that we exist. If we don't have the capacity to even provide enough services for all of the need, we definitely aren't just having the awareness that we need out in our own community of people. Also having hard conversations and continuing this one and continuing to bring up that awareness for us. And you know what, that's it.
I'm excited to hear what these folks will say, but What I'm thinking is might be a little like philosophical or whatever, but all of us can do prevention all the time. Like, we should all try to be doing that. And what I mean is like talking about healthy relationships, checking in with our people, showing genuine care for our people. And then when it specifically comes to the LGBTQ plus community, it's shutting down those anti-trans conversations when you hear them, even if you're not a part of it, even if you don't personally know anyone who's trans. My partner goes to the Y, and the stuff that he tells me that he hears, I can't go to the Y. Like, I'm the one that pays the membership, but I know that if I went in there, I would be yelling at people and I would be put at risk because of the just horrible, horrible things that people are saying. And so if you imagine, like, that is just one instance where I know of a space where these conversations are happening, but they're happening all over the place. So we really need you to help us show others that we are human and we deserve basic human respect and dignity. And especially with a lot of the ads during this political season, specifically targeting trans youth and trans individuals. Newsflash, um, you know, equal access to federally funded programs has been a thing for a really long time. And many shelters, even before equal access was mandated, were serving men and survivors of all genders. So, anyone can be a victim of domestic violence. Anyone can be a perpetrator of domestic violence. And that's the other part, like reminding folks whether there is no perfect victim. A victim of domestic violence is not necessarily a white, cisgender, heterosexual woman in a relationship with a man. Like, I am a survivor myself. I had the great fortune of meeting Tracy as my advocate, and I do think that really changed my life, and that's part of why I'm here today. But I didn't choose to reach out to Harbor House. I never would have thought that I could get services from a place like Harbor House. So, Harbor House and other federally funded programs are open to all, and like sharing that information widely. The last thing I would say is like keep inviting us to things like this. You are all leaders, you host events, you have panels, even, there's usually a connection to anti-violence that you can make, whether that's the prevention, youth programs, we all have youth programs. Keep inviting us so that we can make these connections with more people like you, so that we can keep building that grassroots community support. And the last thing is, you were talking about the advocacy at the state legislature. Like, you are all leaders and your voice carries more, I hate to say it, but it's true, carries more impact than, random Joe Schmo, although we need random Joe Schmoes to do it too. You know what I mean?
And just to piggyback 1 second, so like, it's also, you imagine how uncomfortable it is being the only in a space advocating for a community of people that if you start advocating for a community of people, what that looks like when the other people around you who may not be like-minded might all of a sudden start shifting their mindset of what you look like, and you might look like them. And just being aware of those things do happen, and find your community of other leaders, and you might just all be in this room and you might be able to call each other and say, you know what? I shut that down and said, no, not all Black people are just like this. And then that person started treating me different. Well, go and find your community of people. And just as much as there's a community that when organizations like Diverse and Resilient or People of Progression stand up to advocate for the community, there's a community that tries to plot against us sometimes. And they might be the unnamed people, the people that are up somewhere very powerful, and they might be advocating against us. And that we need more folks like yourselves to find your community of you know what, I'm gonna fight the good fight and help fight for these organizations, we really need that. So just trying to bring awareness to relationships can change when you start having these hard conversations. Just be aware of that and know that you're your own support as well in the room.
I think for me, as we move forward and try to do things together for the betterment of wraparound services, and if you take a look at the vast number of people in our community that our programs serve, thousands. And that's just the four of us, right? Thousands of people that we serve. At the end of the day, right now, what we need is funding. And so that we need the support. We need the backing. We need the understanding of where we're at and what we're facing. But also, it is really important for people to understand the vast number of people in our communities that we serve and the impact that we have on our communities. And now we are facing a crisis. And we need the people in our community to try to help us meet that crisis and continue to meet the needs of our community members, from children to our elderly, right? I just got done doing a statewide training with our district attorney about abuse later in life. We have 10,000 people a day turning 65 in our country. And if you look at the numbers of domestic and sexual violence and other violence, that's a lot.
Well, thank you, everybody, for showing up this morning and for caring about us and this issue. I really appreciate it. And I would say I just highly encourage you to stay engaged. Don't walk out today and just kind of let this go behind you. You know, continue to stay on top of this with us. Do your homework, be an aspiring ally in our community. We need more. You know, and I think one thing that Noelle and I really enjoyed and learned a lot from over this past year was we had the opportunity to go to Madison to provide testimony, to really network with a lot of our legislators. Reach is happy to keep all of you informed when there's opportunities that come up where you can engage in that kind of activism as well. We saw it work with the WIS Act that was, you know, even though it's a short-term solution, it worked, and there were a lot of collective voices that were heard in that. And so anything that you can do to be involved, we will definitely keep you informed of that. But really just continue to show the level of care that you showed today by showing up. You know, we really, really appreciate it.
Yeah, questions from the audience? I'll open it up.
I have a question about the funding. You mentioned that preventative education is usually the first thing to go because you have all the other operational. If there's funders that want to support the work that you're doing, is it helpful to restrict it to that preventing ed to ensure that that programming continues, or are you both at the point of, or whoever needs money, is the unrestricted and just letting you decide the most helpful?
I think for us, I always say unrestricted is most helpful because the needs are always changing. And so although, yes, our prevention ed is in need of funding, we also have 39 people on our wait list for therapy right now. And we don't have the capacity to hire on additional team members at this point in time. So those unrestricted funds really allow our leadership, our team, to take a look at what the current need is in that moment and be able to use that funds in a way that's going to best serve the survivors and the community as a whole.
I agree. It's just, it allows us to meet the need at the moment easier. And all of us understand how crucial prevention education is, right? And so but unrestricted allows us to meet the need in the moment better.
Thank you, that's my thought,
And I would say same, except if there's the ability to internally have a recommendation for prevention ed providing organizations, for that to be a qualifier for it to, have more importance for that unrestricted funding, to have some sort of, mold for those applicants to understand, oh, this is unrestricted funding for me as a prevention education provider, so that it's not all willy-nilly.
More questions?
So I'm sitting here and I'm seeing majority of us in this room are women. And probably many of us are from other organizations. I mean, I just run my own business and am personally interested in this topic for my own reasons. How do we engage? I know there's different events. Reach, you have the that Utopia event. Harbor House, you have different events throughout the year. I don't know the culture in the valley, right? But how do we bring more people to the table? Because I feel like, especially with a lot of the conversation that was happening or that's happening, we could bring in more corporate people. Those might be the people that are, okay, I don't have a good way to filter myself. Those might be the people that are trying to F you guys up, right? We bring in more businesses that really care about these issues. How do we bring in more police officers that can learn about, like, okay, hey, how can I orient myself in a better way to both serve and protect all the people in the community? How do we get more people to spaces like this? I don't know what the marketing looked like for this particular event. I only saw it a couple days ago on social. How do we get more people to care and be involved in this work in whatever way that we can be? Because this is a community issue. I mean, I know personally a couple of people in the community who have been abusive, who are doing community work. And to me, I mean, that's just not okay. Who are these people that are hurting people? So it's like, I would love for these programs not to have to exist at all. But how do we educate and invite the community to have these hard conversations? Because I feel like it's sometimes this uphill battle because nobody wants to talk about hard things, and obviously not nobody, right? Us, I hope. But how do we get more people and bigger fish into this sea of complexity?
Oh, that's for us?
More for them. I agree with that.
I mean, I have some ideas and I'll reach out to y'all myself, but like, yeah.
It's a good question though, because I don't think the media, the media's not talking about this, or at least not that I've seen.
Yes, thank you.
Yeah. I think that that's very complex, and it's a very needed complex question. I need a lot of time to process, but off of the top of my head, having organizations like ours stand in solidarity for the most vulnerable and marginalized populations, knowing that if we're able to rise them up, the whole community rises up from that, do you say physiology? Philosophical.
Yeah.
It was close.
When we stand in solidarity and shine the light where it's the most dim, that those, whether it be corporations, whether it be nameless power players, when we're able to stand together, and if there were some sort of event or community awareness outside of this type of table, I think that that would be very helpful because I also, speaking transparently, we have mainstream organizations here and then we have smaller culturally based organizations. There are definitely starkly different amounts of power that attend their events that do not attend our events. So if we were able to do something together where it would either have those players come to the table where they're not coming or even allowing us to sit where they are, that could shift a lot, and it could illuminate to cause that shift of if they did not come to an event because we're at the table and funding may go to us, that it might illuminate and then force a shift.
Well, that has actually been something that I've been thinking about since I accepted the position at Harbor House, which hasn't been that long, by the way. I've been there for 20 years, but I've only been in this position for a few months. But that was something that I had brought up and talked about is we inherited an event that we didn't have the capacity to continue with. But I wanted to try to turn it into a community event that would that we would all benefit from. And so it would be for all of us. And you can talk about it, but we're already talking about doing it and making sure that the larger programs and the smaller programs, because we do need they need more exposure and we have the exposure. And so it would help all of us in the end. So that's something that, again, as soon as I took over and sat with this event, knowing that I didn't have the capacity for it, but if I had help and to change it a little bit, that we could turn it into more of a community event, so.
So I'm probably one of the newest sort of executive directors of women's funds from around the state. There are different women's funds that exist in different cities. We support each other. We're not officially connected, right? But what I will say is I feel so in awe. You know, you said it so well. How can we continue to have these hard conversations as people like Julie, how you've taken me under your wing and mentored me? I have learned that for so many years you have not shied away from hard conversations and what you have planned in the future. And I feel so proud to be in a network of women's funds. And I think that's one of our hallmarks, that we're not afraid to have those hard conversations. And the Women's Fund is often in that unique position of connecting with organizations and also funders. So that's my plug for supporting the Women's Fund here in the Fox Valley.
Thank you. I think we all have work to do, including the Women's Fund, on having these hard conversations and being more inclusive. And I think that's a challenge for all of us. And I think that's the challenge for all of us here. And I think maybe Kristen said it, of who can we talk to within our circles? I think that's a good way to start, is we all have circles of influence and circles of people. And who can we talk to tell them about what we learned today and have those conversations and learn together, like I think Kristen said.
Yes, I'm aware of, I'm one of the few men here. David, it's great to see you. I think one of the biggest things I've learned from I've had the great privilege to learn so much from each of you on the panel, and how we change the narrative, I think, for people who look like me and are in this community is important. And I think we've lost some of it. I think events are a piece of it, because oftentimes they're a safe space for someone like me to show up and just learn. And like, I think of what was the event years ago? It was all men.
Voices of Men.
Voices of Men. Like, it taught me to be how can I be an ally in this space, but also that this isn't a women's issue. And I think that's the narrative a lot of times. And so I guess first, just appreciation for bringing me along in that journey and being able to have those hard conversations and teach me so that I can be an ally, but also like however we can continue to leverage those spaces. And I'm not saying we should have all more events but like, how do we take what is available where where again, education, advocacy, and maybe just starting to poke at some of those things, being a little more courageous in that space, myself included, to be able to do that.
Yes. Also just paying attention to, and I'm a new learner of this. I have shied away from a lot of local or state or national politic things because it's very overwhelming. But the more I start paying attention and looking at that locally and realizing that funding is reviewed at certain local levels, that you can look at those hearings or attend, even if you can't speak, but you might be really surprised of what people who are in power to say yes or no to a funding application of a culturally specific organization, what's being said in those public hearings. I definitely won't point any out here, but I will say that there are some people that look like Greg who will outrightly feel very, very passionate about saying that maybe diverse or resilient or people of progression or another Black or brown org is a supremacy mindset, discriminatory and racist. And these are things that we are being watching public hearings, watching our applications be declined with that rhetoric being said. So having follow-up conversations, getting together and figuring out what can we do to make sure that that person either isn't there or that we educate them and bring them into spaces that they're able to grow.
It's after 10, but that just reminded me. I am bragging a little bit, but I'm on the school board for Appleton Area School District and, supporting public education so that, eventually we can get to a place where we can fully fund mental health support for students and counseling services for students.
Well, thank you all so much for being here. I just want to give a shout out to my community foundation colleagues who are in the room as well. This has been a joint effort in pulling this off in a relatively quick amount of time, but we all agreed as a larger organization's Women's Fund Community Foundation that this was a really important topic that we wanted to get out in front of more people, and even more people we need to, but thank you to the community foundation colleagues as well. And thank you all for taking the time. I know you're very, very busy and have a lot on your plates, and there's really a lot of work that needs to be done. So thank you for spending this time with us this morning. There's some snacks in the back, water, coffee, to each other for as long as you want. Thank you so much for coming. Have a good weekend.
It was nice. It was nice. It's, it wasn't planned to be big. It was, for me, it was just. I didn't want anybody to pay to get in. I didn't want it to be a thing. I just. Did you really? You don't seem nice, but yes. So, I think it was nice to be able